The following occupational qualification is developed by the QCTO in partnership with industry for industry and is offered by accredited skills development providers. Each occupational qualification has 3 components: theory, practical, and work-based experience. This is to ensure that learners are ready and prepared to enter the workplace. This video looks at the occupational qualification of a health information manager.
As the medical establishment grows, it becomes increasingly reliant on electronic medical records for continued patient care. The efficient administration of medical information can increase service capacity, reduce personnel inventory costs, and most importantly, improve the quality of patient care. Health information management is a combination of business, science, and information technology. Typically, some of the information can include history of significant viral and bacterial illnesses, vaccination information, diagnosed allergies and other conditions, and current and past medication and treatment history. All of these pieces of information are critical to the day-to-day care for the thousands of patients served by the healthcare system. Storing all of this knowledge as digital data makes it easy to organize and access, and thus more useful to healthcare professionals serving many patients simultaneously. Healthcare information management is an in-demand career field, and the outlook for job growth is promising.
I am Zukiswa Dubeni, a professional nurse by trade. I have been working as Health Information System Manager for the City of Johannesburg for 6 years. Health information managers deal with health information and ensure that systems are in place for health programs like HIV and AIDS, sexually transmitted infections, tuberculosis, expanded program for immunization, communicable diseases control, child health, maternal and chronic diseases, quality assurance, environmental health, ward health-based outreach team, and health promotion. Health information managers ensures that data is received from various facilities and is captured onto the routine web page and analyzed as prescribed by the National Routine Health Data. Health information managers are also responsible for supplying the standardized data collection tools and training personnel to use and understand data collation and data elements definitions. They also need to ensure that facilities adhere to data flow, completeness, and submission timelines prescribed by the District Health Management Information Systems Policy. We are involved with many annual projects, the occasional projects, and projects that occur every 2 to 3 years. The Health Department conducts national campaigns on an annual basis like the HPV, which is human papilloma virus, and the influenza campaign that we capture data to be accessible at district, provincial, and national level, as well as the World Health Organization. Other campaigns like polio and measles campaign are captured as demand arise, and of course lately the COVID-19. To become a health information manager, you need a grade 12 and to study for a 3-year diploma in information system at a technical college. You can specialize in monitoring and evaluation for health and then get practical on-the-job experience of 6 to 12 months. Analysis of data elements can be a challenge if it is not phrased in an appropriate manner So having a nursing background helps a lot, as it makes more sense. You need good communication skills as you interact with many people on daily basis, and good interpersonal skills to be able to reach everybody's level of understanding. Computer skills is a must, preferable Microsoft Excel and PowerPoint for presentation process, and you need to be analytical by nature and good with maths. You need an office space with PC or laptop, preferable with big spec, to be able to store big data. A color printer, internet connection for collecting and sharing data, external hard drive with enough space for backup and security of data, Tier.NET application software and standardized updated data tools as prescribed by national and provincial offices. We engage with many people and teams, from operational managers, program ops, and data coordinators in the sub-district office, private providers that are reporting data to the sub-district, and NGO partners that are supporting sub-district and the districts. We engage with facility managers, doctors, professional nurses, admin clerks, and data capturers. We also engage with clinic managers regarding primary health care management, non-medical sites allocated in the regions, and also monitoring and evaluation officers. We liaise with ICT departments from time to time and the service provider that is responsible for the National Capturing System application. This job stimulates your brain every time there is a new system update and keeps you ready to move to the new phase. I enjoy interacting with data and being engaged with national health priority programs and making sense out of it. Facilities taking full ownership of their data, good performance of the indicators, and positive impactful growth is the most important aspect of this work. Health information systems are the pillar of health programs, as everyone needs to get data to be able to understand or have a bigger picture of what is happening to our population's health, and good quality data informs decision making on what needs to be done. Sometimes I feel that it is unfortunate that monitoring and evaluation is not taken seriously up until people get a visit from the Auditor General or get results that they're not performing well, instead of monitoring their data on a daily, weekly, and monthly basis. In this career, you can start as a data coordinator and progress to monitoring and evaluation programmer. And from there, you can become a manager for information systems and ultimately work in a sub-district, district, provincial, or national level. You can also teach at the different levels or set up your own business as a consultant. I feel so good about this career because at the end of the day, I am actively involved with all the health priority programs by analyzing their indicators and understanding the various district strengths and weaknesses. Health information supplied by facilities plays a big role by making society aware of the disease burden in catchment areas. By looking at our data, this industry assists stakeholders who need to make vital decisions. For instance, looking at the patient head count and experience of care gives an indication if a specific area or facility needs extension of services, or if a new clinic needs to be built for adequate health services to reach everyone in those communities.
For more information about this qualification, log on to www.qcto.org.za. Inquire at info@qcto.org.za. Call us on 012-003-1800 or view our Facebook QCTO page. This video is brought to you by the QCTO's Marketing and Communication Unit.